Hello, everyone. Lance here, and I want to share some effective strategies for managing behavioral changes in advanced dementia. Some key strategies include communication techniques. Use calm, reassuring tones and simple language. Allow extra time for responses and avoid criticizing or correcting the person. Offer simple choices, no more than two at a time, and use visual or tactile prompts. Maintain eye contact, smile, and use gentle touch to convey compassion. Environmental modifications. Simplify the environment by reducing clutter, noise, and unnecessary objects. Ensure adequate lighting and minimize confusing patterns or mirrors. Establish predictable routines to provide a sense of security. Now let's talk about activity and engagement. Engage the person in meaningful, familiar activities tailored to their interests and abilities, such as music, art, reminiscence, or folding laundry. Encourage regular physical activities, like walking or simple exercises to help reduce agitation and improve sleep. Use distractions, such as favorite foods or personal objects, to redirect attention from distressing stimuli. Now, let's talk about emotional validation and redirection. Validate the person's emotions before attempting to redirect their attention. For example, acknowledge feelings of sadness or anxiety, then gently shift focus to a comforting activity or memory. Avoid arguing or trying to reason with the person. Instead, join their reality and provide reassurances. Now, for caregiver support and education, caregiver training in problem solving, communication, and task simplification is crucial. Seek support from professionals and respite services to reduce caregiver stress and burnout. Now, let's talk about monitoring and individualization. Keep a journal to track behavioral patterns and identify triggers. Adjust strategies based on what works best for the individual, as responses to interventions can vary. Specialized programs and approaches are important as well. Utilize evidence-based programs like Dementia Care Mapping or DCM, tailored activity programs or TAP, and describe, investigate, create, evaluate, or also known as DICE, to systematically assess and address behavioral symptoms.